So next we get to hear from a good friend of mine and many of you here, Lindsey Mullis. And I can say from my opinion, she's our nation's expert in inclusive design, universal design for people with disabilities, including intellectual and developmental disabilities. She teaches all over the place, and every time people are in awe, like, oh, how simple. I could do that, but it wouldn't have occurred to me. So we're really lucky to have her at this presentation today. Thanks for coming, Lindsey. I'll read you this information in case you weren't able to pick it up from the QR code, which is the way to go on conferences for sure. As the Inclusive Health Wellness Director for the University of Kentucky's Human Development Institute, her responsibilities include promoting inclusive health for people with disabilities and communities that they serve. She serves as the Health Promotion Clinical Director for Special Olympics Kentucky. She has expertise in applying universal design strategies to health programs and services at local, national, and international levels. These incorporate inclusive strategies and broader access, and she's done this for over 15 years working with the disability community. Her degrees are in psychology, exercise science, and health promotion with a certificate in developmental disabilities, and she's working on her PhD in health education. She's our Renaissance woman, and she's going to help us today do a better job in inclusion.
Thank you, Mary, for such an incredible introduction. My name is Lindsey Mullis. I am a white woman with dark blonde hair, a tired mom. I am not only a passionate health and disability advocate, but also a passionate parent advocate. I have 3 lovely young girls, the oldest of which, Caroline, we adopted from China when she was 3, and she experiences Down syndrome and a vision disability. So I'm excited to talk to you all today about inclusive health and universal design and think of ways that people like Caroline can access the incredible programs and services that you all offer. And so just getting started, what am I talking about today is this great comic that has, I'm sure you all are familiar from Montana, a bunch of snow on the stairs and the ramp. And there's a kiddo in a chair that says, could you please shovel the ramp? And the gentleman shoveling the snow says, all these other kids are waiting to use the stairs. When I get through shoveling them off, then I will clear the ramp for you. But the kiddo in the wheelchair says, but if you shovel the ramp, we can all get in. And that's what universal design is. So when we're talking about people with disabilities, Americans with Disabilities Act gives us the definition that it's a person who has a physical, mental impairment that substantially limits one or more major life activity with a record of such impairment or who are regarded as having a disability. Pretty straightforward, but what I really like to use as a definition is the World Health Organization, because it looks at disability as referring to the interaction between individuals with a health condition and their personal and environmental factors. So for example, a person with Down syndrome without reliable transportation, which you heard yesterday was a big barrier, only has paid supports, provided information at an 8th grade reading level that's not accessible to them. So that's their experience of a disability. And the image on the slide shows the traditional picture of disability as someone disabled, but also a traditional picture of a stick figure as disabled as well, because not all disabilities are visible. So thinking about how that individual experience impacts someone's disability. This is another way to look at defining disability. These are the 6 demographic questions as set forth by the American Community Survey and the Health and Human Services. You can see there's questions for functional disability experience. There's a question for hearing, vision, cognitive, mobility, self-care, and independent living. If someone answers yes to any one of those 6 questions, then they would identify as having a disability in that functional type. And so this is helpful for us to learn about disability, their experience. It helps us in a lot of ways. What I've learned through my research is by adding a 7th self-identifying question of just, do you have a disability, is also important, because somebody having a disability is so much more than just their diagnosis. It's about that experience that we just talked about, right, that they're having. So they could be having a really great day. Maybe their chronic condition is not having a flare-up. Or maybe for Caroline, she is living her best life, knows that she has a Down syndrome diagnosis, but wouldn't say yes to any of those functional disability questions. But she would say yes to the 7th one. So thinking about that and how we're really defining disability. And this is so important because we need this data. I mentioned earlier yesterday, that's one of really great ways to get the conversation started. Having this data standardizes our info between people with and without disabilities. It helps us inform across state lines, agencies, programs. But then for me as a programmer at heart, it's helping me disaggregate that data. I can provide better supports to people that I'm supporting in my program, increasing my accommodations. It's educating on unique participant experiences. And then it's my program responsibility to do that as well. And then lastly, for the individual, now I'm providing them with person-centered approach. It's increasing their support, their access to the program, their accessibility methods, those considerations. It's broadening recruitment. So having those questions asked is just a really simple way to hit all of these things in a really positive way. Because disability is not an outcome, it's a demographic. And this is really important to remember, that we're working with people. And importantly, also to note that the NIH back in September designated people with disabilities as a population with health disparities. So that's a hopeful, exciting future for us to be able to get funding and research to really include people with disabilities in health promotion efforts, to be able to have that data to tell the bigger picture of that story. If we look at the history of disability in America, the images on the slide show some from Tom Olin and the disability rights movement. The first image on the slide with Judy Heumann there says that injustice anywhere is a threat to justice everywhere. And so we think about how the disability justice movement mirrors the civil rights movement. A lot of the past, even just as recent as 20 years ago, individuals with intellectual and developmental disabilities were living in institutions in really dire and not healthy environments and situations. And in moving from that, there's been an effort to produce group homes and getting them out of those institutions and into group settings, which in those congregate settings is better than the institution, but we're not still really promoting community involvement, which has been the next push, is having that community living, the access to the community outreach, the programs, the things that you all are doing so wonderfully in your community, and having people with disabilities be able to access those and to do it in a universal way. We've heard a lot so far about the medical model versus the social model of disability. And so the graphic on this slide, the medical model is saying that her impairment is the problem. They should cure her or give her prosthetics. And the image shows a woman in a wheelchair sitting at the feet of some stairs that has a sign saying, "Weigh in, everyone welcome." Not so much, right? If the stairs are the issue, she can't get into wherever she's trying to go. The social model of disability is saying that the stairs are the problem and they should build a ramp to provide that access. When I talk about the social model of disability, I like to use this graphic and image as well that has the system as a square, and the square is saying you're going to have to change to fit into the system. But the circles are saying, how about you change the system so we can all fit, right? So again, thinking about that social model that Tom and that Chris mentioned. I like to also give this image of Jimmy Fallon trying on Shaq's suit jacket. So thinking about, what if the entire world was built for the people the size of Shaq, right? We would all have a disability. We would have a hard time reaching the steering wheels or the gas pedals of our cars, and the doors might be too heavy for us to open by hand. So thinking about, that's what that social model of disability is like. And that's where we, us in this room, have the power to make a difference, to overcome those barriers for people to have access. There's also another model of disability called the human rights model of disability. And this understands that disability is a natural part of the human experience. It calls for inclusion and equality as a human right, and has the motto of the disability movement of nothing about us without us. So this is a world in which every body and mind is known as beautiful, and we're including people with disabilities in our planning committees in the ways that we're talking about the things that we're trying to accomplish, and we're making sure that they are included in that aspect of everything. This is important because we've talked about the rate of disability in the nation. That's 28.7%, or 1 in 4 adults experience a disability. So that means there's people that are answering yes to one of those 6 disability demographic questions I mentioned earlier. The most common is cognitive and mobility disability. And what's important to note here is that people can answer yes to more than one of those questions, or like I was saying, it's not stagnant, that experience of disability can fluctuate. Yes, adults, yep. And in Montana, your all's number matches the national average at 28.7 people, adults in Montana, that have a disability. And so that is important for us to think about making sure you're ensuring that equal access, right? If we've got such a large proportion of people experiencing disability. Specifically for health in Montana, here's some universally designed data visualization of health outcomes for your state. In pink are those with a disability, and in orange are those without a disability. So within Montana, disabled people are almost 2 times as likely to have diabetes at 11.4 compared to 5%. 29.3% of Montanans with a disability are inactive versus only 16.9% without a disability. And then almost half of people with disabilities have high blood pressure at 35.4 compared to 23.5%. And then more than half of people with disabilities have experienced, or close to half of people with disabilities have experienced depression at 47.2 compared to 18.4. And it's important to note here that it's not because of the disability that these health outcomes are occurring. It's because of their barriers, the lack of access, the lack of universal design is producing these health outcomes. And when it comes to smoking, in Montana, 25.6% of people with disabilities are smokers compared to 12.5% of people without a disability. So that's quite a staggering difference. And then data from Special Olympics shows that 48% of Special Olympic athletes report exposure to secondhand smoke. So that's almost half of the athlete population. And these are, again, are all things that we can think about addressing in the work that we do, because there's our barriers that exist, right? We talked about some of those yesterday. We've got physical barriers within the built environment, attitudinal, which is the #1 barrier of ways that people are having ableism, our resources, whether that's time, energy, or money, the communication barriers, which includes our information barriers, and then so much more with things like policies and the systematic approaches, all of those things that can really give us barriers for people with disabilities to access. With physical barriers, again, that's the role of the built environment with the structural obstacles that are either natural or man-made, with no ramp, poor signage, poor lighting. These are things that need to be considered prior to your programming. Somewhere, if you're going to do something in the community, where you go out and scope and make sure that there's accessibility for that program. This is a picture that I included since we were on the University of Montana. This is on campus in Kentucky. Jackie, you recognize that building? What is that? Yeah, that's Funkhauser. That's our administrative building, where the registrar's office is. The huge big old flight of stairs leading up to the building. There on the sidewalk, you can see the disability symbol. The reason for that is because that is like a breadcrumb leading your way to the accessible entrance. That is around the back of the building, next to the dumpsters. So, even if the built environment is accessible, that does not mean that it is meaningfully welcoming, right? The day that I took that picture with my colleague Cody, I have a rain jacket on, it was raining. So if I were to hop on up the stairs and say, I'll see you inside, Cody, so I don't want to get wet, right? Versus walking all the way around the building where he had to access the building near the stinky dumpsters. So when we're thinking about physical barriers, we need to think so much broader than just someone getting into the building. It really needs to be engaging and meaningful and accessible in that welcoming way. And that leads us to the attitudinal barriers, which I mentioned is the most common form. This results from a lack of understanding. It can include people's behaviors, their perceptions, their assumptions about individuals' disabilities, and it can lead them to ignore, judge, or have misconceptions or stereotypes. The quote on the slide says, "You can build a ramp to get anyone into a building, but truly is attitude that facilitates real inclusion." And then with information and communication barriers, this is considering how that information is given and how it's received by individuals. This can most often occur for folks that have hearing, speaking, reading, writing, or understanding disabilities, but it's also true for individuals that have a different language or cultural considerations. So we're thinking about how that information is we're providing, what kind of accommodations we're having. There's a picture on the slide that has a communication device. So thinking about technology, our interpreters, all of the ways that we can really broaden that access. And the graphic on this slide I love, it says, "Does this make sense to you, madam?" And the person's holding up an infographic and the madam says, "Nope, not at all." And the individuals in the back are devastated. "No, we'd worked so hard," right? But likely what they did was they didn't include the people that they were targeting, right? Or the folks with disabilities to make sure that they were actually hitting the mark in what they were doing with their information. And then resource barriers. This can be more pronounced for people with disabilities and their support networks. Financial is the first one that comes to mind. They're more likely to be below the poverty line, more likely to incur additional healthcare costs. The CDC says that 1 in 3 adults with disabilities have an unmet healthcare need because of costs in the past year. So that's definitely more profound for folks with disabilities. But then also resources include time and energy. So I have a colleague who needed to have surgery, and he was scheduled for a 6 a.m. surgery. He's a wheelchair user and an amputee, and for him to be able to get up in the morning and get to a 6 a.m. surgery when he doesn't even live close to the hospital, that's a 2 a.m. wake up for him and his wife to get there. So just thinking about those additional considerations for someone who's experiencing a disability, and then the energy that goes to that. Being a parent of a child with a disability, she's a lot more health appointments and things that I have to coordinate, her IEP for her education, all of those things. So for me as a caregiver, thinking about that and that support network as the entire package when you're working to support and finding resources for individuals with disabilities. So this brings it all together with our image of the disability and health spiral. I mentioned that individuals with disabilities experience more poverty, they're at higher risk for trauma, injury, and disease, which results in poorer health, lower access to health care, higher risk of disability, risk of increased poverty and exclusion, and you can see what's happening here. It's a cyclical cycle, and so this is where you come in. How can we help break this cycle, address those barriers, and what can we do to promote broader access? So while I'm settling that seed in your brain, let's think about what kind of learner are you? So we're going to do a little activity. I'm going to ask some questions, some scenarios. And if you answer as a visual learner, you're going to give me the 3 goggles like this. If you're an auditory learner, you're going to put your hand behind your ear. And if you're kinesthetic, you can either stand, stretch your legs a little bit, or raise your hand. And that'll be how we show what you are. Ready? Okay. So if I need to learn how to do something, I learn best when I watch someone show me how, hear someone tell me how, or try to do it for myself. This is all for you. No wrong answers. You can have more than one. Okay. All right. If I had to remember a list of items, I would remember it best if I write them down, say them over and over to myself, move around, and use my fingers to name each item. I don't think I can do all 3. But that's what I need to remember things. When asked to give directions, I see the actual places in my mind as I say them, or prefer to draw them, have no difficulty speaking them, point or move my body as I give them. Okay, I'm glad to see a couple other hands raised. In the South, I like clothesline people when I'm trying to give directions. You should have turned back there. Yeah. When trying to recall names, I remember nothing. That's me. Faces but forget names, names but forget faces, the situation where I met the person rather than the person's name or face. Yeah. So did anybody have the same answer for every scenario? Yeah, no, right? So you might have thought initially when I started this activity, oh, I'm a visual learner, that's going to be me. But when we change the scenario, it impacts how you're going to access or present that information, right, to somebody else. So that's why it's really important to think about how can we broaden that access for everybody, get everybody to that same goal. And that's where universal design can help. So that is universal design is avoiding what's in this comic. So there's a test exam proctor with all these animals. He's saying for a fair selection, everybody has to take the same exam. Please climb that tree. Who's going to ace that test? Yeah, the monkey. Yeah. What about the bird? Might squeak by with a bee because he'll fly to the top but not climb there. I don't think the elephant has a chance. And the poor goldfish is going to die trying if he jumps out of that bowl, right? So that is what we are avoiding. Universal design is going to maximize meaningful access, understanding, and use of environments by all people, regardless of disability, age, or size. And when we say environments, that means buildings, products, resources, programs, services, all of those things. So universal design and inclusion. When I mention universal design or UD, I'm talking about universal design where it could be the built environment, the streets, those kinds of things, or universal design for learning if you're talking about curriculum or in the classroom, combining all of that into one thought process of universal design. And it's something that can be incorporated into any existing health program, service, or resource. We can make UD adaptations that do not need to change the content. We mentioned that yesterday as a barrier. And UD increases the inclusion and accessibility for everybody. So your toolkit for this morning to take with you, Lindsey, how do we do this? How do we do universal design? You're going to just UD it. Yeah, that's your acronym to take with you. There's also a handout in your folder as well that takes this acronym so you can put it to work in your practice. But we're going to talk through each of these letters for just. The first one, J, jazz it up. You want to engage your audience. You want to make it meaningful. Whenever I have to do this presentation on Zoom and people have their camera off, I really hope that's not what they look like on the other side of the screen. You all can't do that for me in person. But you want to make it engaging, right? You want to make sure it's more than just that the building's accessible, that it is meaningful. Because doing boring or basic, that's not universal design. We want to really make sure that it's jazzy, it's colorful, it's engaging, it's something that people want to be involved with because they feel welcomed. The U is using multiple methods. So this includes written text, having visuals, including pictures with alternative text, using models. If you've got audio, having a transcript. If there's video, including closed captioning. Have interactive opportunities for role play or demonstration. And then touch, having that kinesthetic opportunity for learning. So on the slide, there's an example here of a blood pressure locator tool. This is my first experience when I was green. Had just started working with our partners at the State Department of Public Health. It was a blood pressure awareness program, and they did not want to include people with disabilities because it was going to lower their cognition rates. And they also told me that somebody in a wheelchair can't exercise. So Jackie can attest to this. I don't have a very good poker face, but I took a deep breath and I said, well, at least let me try a pilot. And so I created this blood pressure locator tool in PowerPoint, friends. I'm not a graphic designer. And so what you can see there is we've got color. So for someone who doesn't understand that the higher numbers are bad, we've got red and yellow and green, but there's also emoticons that show the faces for someone who could be colorblind or from a different culture that might not understand that red means bad or red means stop. With the numbers, we added the numbers for people to, if they don't understand that 135 is above 120, being able to talk through that or point that out on this handout, and then having the words there. So all of these multiple methods broaden that access for people that would maybe have trouble understanding where their blood pressures were going to fall. And then guess what? Their cognition numbers for my pilot was higher than what their general cognition numbers were. And so they actually started to use some of these universal design principles into their practice. Here's some examples, since we were here talking about nutrition, is picture recipes. And I know for me, that helps me knowing what I need from the pantry, what ingredients I need to have. I don't know how many times I've read through just a word recipe and I've skipped a step and then I've messed something up, right? So having picture recipes is another great example of universal design. And then multiple means of engagement also for physical activity. How many of you all have heard 10,000 steps a day? Right? That's not inclusive language for everyone. So a simple update to just making it minutes of activity. That way everybody can move in the way that works best for them. I'm hoping when I click this button, it'll start the video. No. Anywho, so if that video played, it would be an example of 3 different modifications for jumping jacks. Right, so we've got Heidi, who's in a wheelchair. She's using just her upper body, moving her arms. Harold, our older adult individual there, is doing just taps outside to side. And then Mark, the younger individual, is actually shifting his weight as he's going from side to side. So different multiple ways that you can do the same activity to really give people that way to access it in the best way that works for them. The S in just is for simplify. I know that's hard for some of us, especially for academics, but if we can use plain language, it's more broadly accessible to everybody. Keeping it short and concise, it's more digestible. If you're using written text, have large, easy to read fonts. Sans serif means we're not using the fancy calligraphy fonts, things that do not have the extra markers on the edge of the letters. And then for the font size, no smaller than 24 on your slides or 14 or screen and print. And then space out your wording, use that white space, and then use bold or underline to help really drive home your most important messages, and then using lists or short sentences. So on the image there, you can see in the blue box, it says, "Can you read me?" That contrast is high. It's easier for those of y'all in the back that are trying to look at this front screen far away. You can read that. Yeah? Yeah, Damien's shaking his head at me. How about the green box? Not so much, right? So the red is not so contrast, and then there's yellow there that you might not be able to see at all that says, "Can you read me?" So thinking about the color contrast as well for accessibility. And then our T is test it out. You got to consult the experts. Whoever your intended population is, get their feedback and then incorporate that feedback. Actually listen to what it is that they are telling you and then make it so. That goes with that "nothing about us without us" slogan. The graphic here is some folks with cats on their heads, these green people, and there's a blue individual with the binoculars backwards saying, "This population seems awfully hard to reach." And then the green cat folks are saying, "We're right here. All you need to do is try." Yeah. And then the T is also for us programmers, the teach back method. Such a great technique. This is where you share a concept, you ask the individual to repeat it back in their own words, then you listen for any incorrect or missing information, and then you share the concept again, rephrase it, ask them to repeat it back. It's checking for understanding. Sometimes this can take a long time. Repeating it as many times as you need, but really making sure that the information that you're providing is being received accurately. So UD is going to help us support people with disabilities to access our programs, but what's even better is that it really helps everybody. This example here is the curb cut effect. So when we're designing for disabilities, we make things better for everyone. The curb cut there is highlighted in red. So an individual with a wheelchair can access the road with the curb cut, but also parents that are pushing a stroller. There's an individual there with their luggage, or someone with a cane. We've got someone pushing a dolly with heavy boxes, individuals on their bikes, or I like to think the individual in the back's maybe getting a smoothie, got their skateboard. Everybody benefits from that curb cut, and that's what universal design is going to do. And then once we get that, we've paved the way, everybody's getting to the same goal in the same simple way, then we have targeted universalism. So this is where we're thinking about everybody has the same opportunity, we're reaching the same goal. Now there might be some strategies and interventions that might need to be targeted for some individualized approaches. So that could be accommodations, modifications, supplemental information, these kinds of things that are that targeted approach, but they're not going to lead to segregation or exclusion. It's just providing that individualized consideration. This is an image from the Robert Wood Johnson Foundation that helps explain that a little bit better. We all know equality. We talked about health equity yesterday. So we see the individuals all get the same kind of bike. Doesn't work for everybody, right? But what else do you notice about the pink background? Yep, the terrain. The terrain is different. So the little guy up top has a rocky terrain. So what he needs for health equity is not just a smaller bike, but a mountain bike that has the big wheels. Our individual in the middle was doing just fine on his flat terrain with the regular bike that was initially planned for. But then at the bottom, she doesn't need a bike at all. She needs a motorized wheelchair to get up the steep incline. So that's what that targeted universalism is thinking about. So we're all going the same place, but might need to think about some individual considerations. So here's some examples for you. This is an original handout from the Kentucky Department of Public Health on triglycerides. You know, they used their white space. They've got some lists. There's a clip art of a heart with a Band-Aid. They did their best. And that's what they're handing out to people that needed to learn about their triglycerides. So we worked with them to UD it. So you can see here, we've got those universal design principles. It's jazzy, it's colorful. We've got the simple language, we've got the graphics, we've got the bolded letters, we've got the examples of food. Do you all like that one a little bit better? Yeah, that one might not go in the trash within 2 minutes of someone leaving the office. Hopefully not, right? And then we have the tailored approach. We have a high Spanish-speaking population in the state of Kentucky. So then we specifically made sure that we had a Spanish version of that same handout so that we could have targeted those communities. You might say, okay, that's great, Lindsey. I don't know how to use Canva or PowerPoint or have access to a graphic designer. That's okay too, because now you know what more to look for that's universally designed. These are examples of things I found on the internet. So these are already things that are out there that are using those universal design principles that you can go ahead and put into practice. Some additional considerations are for supporting people with disabilities, allowing for extra time. That's going to be really important to make sure that they have the time that they need. Asking questions, asking those disability demographic questions, getting that data, getting that information and identifying their disability, but then asking them questions as well, and providing choice, giving people the opportunity to choose or having that autonomy, especially for our individuals' disabilities, that's so important. Addressing the individual, making sure that they are the ones that you're serving, including their support network as a part of that supportive role, but the individual is the one that we need to be addressing. Considering physical space, we've talked about that, the physical access, as well as the cost and the schedule. Those are going to be things that really matter for accessibility. Our communication methods, making sure that we have those multiple modalities there as well, providing opportunities for people to communicate in the way that is best for them. And then providing supplemental materials so that we're broadening the access, the understanding, and the communication of what it is, the service that we're providing, having those supplemental materials available. And then thinking about the support network. My colleague Morgan, that I wish I could have brought today, is an incredible Special Olympics athlete. He also has a physical disability. Whenever I'm working to support him, I include his mother in what that looks like. Morgan doesn't drive, so making sure that I'm thinking about her as a part of that conversation and that support for making sure he gets what he needs and that she is able to help provide that. And then transportation, we mentioned that yesterday, is always one of the biggest barriers. So thinking of that from the front end to help be a part of that universal design approach. This is from the Americans with Disabilities Act. Chris said yesterday, being inclusive is justice. It's what we should be doing. It's also the law. This is a quote from there that states that each service, program, or activity is readily accessible to and usable by individuals with disabilities through inclusion. So that's what the ADA is just stating. It's not just about built environment, it's so much more. When we say inclusion, this is on the back of that Just UGET handout. This is an image that my team and I created that shows where in individual disabilities or any vulnerable population are those colored dots there. And exclusion is when they're completely excluded from the programming. Segregation is where they have a program that's separated, but that's just for them. And sometimes that could be part of the targeted universalism approach. Maybe you're working with a group home when you're doing a nutrition program with that, and because that's where they're already congregated. But when segregation happens, it's because they are intentionally not being included, right, in an inclusive way. That's different. That's because they're not welcomed. Integration is when they are maybe in the program in the building, but they're doing their own thing in the back. Morgan likes to give the example of how, in school, he might have been in the special education classroom. So he was in the school, but he wasn't in the classroom doing the same thing as his peers. So true inclusion is where individuals who might otherwise be excluded or marginalized are equally appreciated, welcomed, and valued all together. So, yeah. Mm-hmm. In what? There isn't one up here. Oh, on the chair.
I just for people with disabilities and people with intellectual and developmental disabilities, the importance of recognizing the high risk for abuse and neglect. I mean, we're in this moment where we, through colonization of indigenous people, segregated their kids, and in the same way we've done that with people with disabilities, and that just really allows for predation and violence. When we separate people from their families and from the community. So I just wanted to make that point that absolutely, sometimes we have tailored programs. People have chosen to say, this is our program, this is how we do it, or this is where we live, and so please bring the resources to us. Transportation is too big a barrier for us. We want to do that at our home. But just really wanting to bring forward that some of the data that you've shared is also complemented by that incredibly high risks and the experiences of violence and abuse by people with disabilities.
Yeah, thank you, Meg, for sharing that. And that's why I mentioned that the segregation image is different than just there being a separate program, right? Like the tailored approach. It's about that divide.
Yeah. And so when we talk about justice, we also mean reconciliation for some of the, history of abuse and neglect that people have experienced.
Mhm. Yeah, and for folks with intellectual and developmental disabilities, they're 7 times more likely to be sexually assaulted and higher rates of interpersonal violence, which is the area for my study for my PhD is on sexuality of individuals with IDD. So that's a really important concept when we're thinking about inclusion and providing opportunities for individuals with disabilities to have that support to be meaningfully included in their communities to help address that concern and that barrier.
And many people who have family members with IDD, that's a big consideration. Am I going to support this person to go to that space? Will they be safe? Can I take a break from my role supporting that person?
Yeah, and get that
In
respite.
yeah.
Yeah. And that's where you all come in, right? By making that appreciated, welcomed, and valued and safe space for people in your programs and the services that you offer, because it's so needed. Yeah. Yeah. Thanks, Meg. So some resources I brought for you all today. Mary mentioned yesterday that the Special Olympics does have some inclusive health fundamentals and other health courses on their e-learning website. So that is one of the websites where you can learn more about supporting individuals with intellectual and developmental disabilities. The handouts that hopefully you all got yesterday from the NICPAD with their SNAP settings, it is not currently accessible virtually. They're having a website update. So they're working on it, but you got hard copies yesterday. If you didn't, Mary has got some more. But those are looking at how you can make inclusive SNAP settings and being mindful of disabilities. And then for web accessibility, there's w3.org that can look through if you've got a website that you're running and look at some of the accessibility considerations for that. Bingo Size is a super fun program that I work with. That's exactly what it sounds like. We play bingo, we do a little exercise, and there are also health education modules within that. And so I've been working with the Bingo Size creator to infuse universal design principles in there. We've updated the exercise videos to have the multiple modalities, the adaptations, including people of different ages and ability levels, ethnicities that are in those exercise videos. And so we're continuing to work to broaden the access of that program. And then Healthy for Life from the American Heart Association. They have their Healthy for Life program is a nutrition education program that is free. All you have to do is sign up as a facilitator and agree to their terms and service. So I wanted to mention that it is in the SNAP-Ed toolkit. I worked with them to incorporate universal design into their 12 main lessons that were most popular. So they have scripted PowerPoints that use inclusive language and imagery. And again, that's something that's free. It was created with Aramark, and I know that American Heart Association Aramark are going in different directions for their future journey. So there might be some shifts and changes in the marketing of Healthy for Life. But I wanted to make sure to mention that so you guys know it's a resource. And then for those of you all that are making recipes and you want to make graphic recipes, accessiblechef.com is a way that you can do that on your own. You can go in there and select the images of the ingredients and the steps that you need to do and make your own graphic recipes for the nutrition programming that you've got. And that's another free resource for you all. So wanted to have those in your back pocket as well as the acronym of JUST. Don't forget that. I see somebody taking pictures. So yeah. So in summary, disability is an experience, and it's one that influences people's interaction with the world. We as programmers have the responsibility to honor and support the whole individual, and universal design that I gave you a little taste about today is a key success strategy in including everyone. And sometimes that tailored approach is necessary for ensuring access and safety. So for us to provide accessible and inclusive tailored approach, universal design, those are the takeaways for you all today. And the little graphic there is just all of our different colored blobby people going in the direction of health literacy, health equity, and public health. Yeah. So I had to include a picture of my girls because I mentioned them at the beginning during my inclusive introduction. And if that was different for you, an inclusive introduction is helpful for folks who might have a visual disability, but also you wouldn't have known that I'm a parent, and I bring that lens to today's presentation if I didn't share that. So also making that a part of the inclusive introduction. So it's something that you all are aware of. So that's Caroline, my little China doll on the left, and then her 2 sisters there. And so you've got lots of resources. I shared the Just You Do It toolkit, but this is also my contact information. Consider me a friend. I'm happy to help in any way. And I think there's just a few minutes for questions if anybody's got any.
Thanks. Lindsay, I was wondering if we are planning a program and we're sending a registration out, like a survey to register for the program, is there a standard for questions to ask? Like, do you have a disability? I know you gave those 7 questions, but I'm just thinking about survey questions that I can include to say, like, what accommodations do you need?
Yeah.
Are there standard questions to ask for those?
That's a great question. So currently those disability demographic questions are the standard for identifying disability. We as a disability community of researchers understand they're not perfect, but that's our standard set and our foundation. And there's actual a national conversation that's going on about updating those and working to make them more like specific. But so that's my encouragement for any programmers is to ask those questions, to capture that data, to have that information so that it can be shared, but then also for you who's planning so you can know what kind of questions to follow up with people who might need accommodations. And then in my practice, just asking a simple, accommodation question of like, do you require any supports to fully participate in the program? Some folks like to say, do you require any accommodations? I typically err on the first of those just because it's a little more plain language of asking if someone requires supports, because they might not know that they need accommodations, but in that way they might be able to say, oh, if it's a walking with ease program, I can't do stairs. And you could get that information and know how to plan your walking route differently by asking about what supports they need. Or one of the ones I got was there was an individual who had migraines and asked for the lights to be dimmed. So you're able to capture those specific tailored things that those general 6 questions wouldn't necessarily capture. Yeah, good question.
Lindsay, could you mention how people can access all the graphic recipe products and resources that you have on your website?
Absolutely. So the website that is on the slide, wellness4ky.org, that is the resource library that my team and I run. Any grant funding, any projects I've ever done, even with the American Heart Association. That one was hard. I had to twist the arm. My one request is whatever resources we create, I don't want them to be proprietary. I want them to be community facing. So all of the graphic recipes that we've created with our partners, other than UK Extension, they have theirs on their website. And I'm sure Jackie will share that. All of our adaptive exercise videos that we have in the handouts that you all saw, the serving size one is one that we created. So please check out that website and put those resources to work for you all in your communities because they're free for download. And we've got more in the works, working with some diabetes resource centers in Kentucky. So we're working on those next. And if there's something in particular that you're looking for, feel free to reach out and I can see if we can find it for you. Yeah, thanks, Mary.
I have a question about, we are working with the Black Manpower Program and their Voc Rehab addresses helping people with disabilities be more employable. And when we were talking about the questions to ask to identify people with disabilities, and I hope I'm not misunderstanding them, but they seem to indicate that you couldn't like ask people outright on an employment application if they have a disability, that they have to disclose that. And that's one of the major things that they do in our community, the Voc Rehab, is they help the people they work with to be okay with being upfront because they can get a job and then not be able to do some of it without accommodations, but the employers don't know that they needed the accommodations. And so they can get fired or something like that, which to me is very something that I'm not well versed in. But so I was looking at the last question on there, like, do you have a disability? I'm not sure we could incorporate that into employment applications. I don't know.
Yeah, and those questions are more in the disability and health arena and for research. So I would agree with what I know about employment that we wouldn't be able to ask the questions, but you would be able to have the job description, right? Like if you have to lift up to 50 pounds, right? Or certain things, I would think that would be their conversation starter about what maybe those limitations or barriers might be. But those questions that we ask, those are for the public health field. Mhm.
What other questions do we have?
Carrie?
Thought I might go to the
Yeah,
microphone.
right?
Hi, thank you so much for that great presentation. I think it's really inspiring. We all are in organizations, obviously, right? And my own department uses none of these strategies for our graduation, our faculty meeting, and this is the first time I've been at an event that has had the features that I think are best practices. And my question is, as we think about our own organizations, can you give us some ideas as to where to start to make changes at home?
Yeah, that's a great.
Thank you.
question. Absolutely. And so that would be our policy or systematics approach, right? Or environmental approach. So when I first started this job, when I first met Meg, I was working with a program called Health Matters, which is an exercise and nutrition education program for people with IDD. And what we were doing was not just training the staff to implement that program, but we did an organizational needs assessment as well to identify where within the organization there also needed to be supports for education, disability etiquette training, or what was needed. And one of the main goals of that was also looking within their policies for where can we promote inclusion and health equity. And so I think a great success story that I've experienced over the years can be as simple as asking those 6 questions. So we've been able to include that on our community needs assessment for our cancer center within Kentucky. I know within Ohio, within their Department of Public Health, there's a requirement that disability populations be included in all of their grants and their notices of award that are going out from the State Department. So I think if you look at the organizational level, like that's the starting point, is if you can look at those policies where inclusion and consideration for disability isn't currently being considered and where it can be added, and specifically from a public health college level. I know there was a recent article that came out by Don Lawler that looked across the nation for public health programs to see which ones were including disability. And I'm sure you're not surprised to find out that there's not very many public health programs that are educating future health professionals about disability. And that's not just in public health, that's in the medical field too. There's a minimal amount of education information that students are getting about disability. So I think that's another area that I would love to talk to you about, is what we can do to infuse some disability education within the curriculum for the future generations.
So I want to follow up on a question that I asked you last time we met in DC.
Don't
And
remember.
That's okay. So I asked, with the proliferation of AI, are there any good AI tools for universal design? And the answer, was largely not really. But so 2 things that I wanted to make a comment, and then I wanted to ask a question. So what I did start doing, and I did it right now, I have ChatGPT on my phone. On my phone, uploaded a PowerPoint presentation that I use related to my research and asked it to provide specific recommendations for universal design. And it did. It came back and it said, I need to do some role clarity, some contrast, a larger font. I need to work on spacing, use of icons, alt text, and use plain language and clarity. So, but the caveat there is that ChatGPT can't always be trusted. So that's a great step. But my question is, do you know, are there organizations or services out there where we can, send materials and be like, can you help us identify how we can make these more universally designed? I know you mentioned that you did it for some organizations, but is there an organization maybe nationally that does that?
Not that I'm aware of. It would be incredible if there was one. If you want to start a nonprofit, come see me. We'll figure it out.
Sorry, I was just gonna say, there is capacity, and it is within the national network. It's harder to find locally because disability is a community that exists without geography. So many of the people who have this capacity have organized from remote work locations into national organizations. So the World Institute on Disability, for example, has a whole user group that is professional and ready to test materials and give professional feedback on how to improve those materials. The World Institute on the world, the whole world. Yeah, exactly. I always swallow rural. Anyway, World Institute. So Marcy Roth is our executive director of WID. And so that's somebody that we can put in contact. But again, they're going to set their priority for the high impact materials, right? And so we have to kind of think about building some local capacity for that. And we do that in Montana. Feel like we should have coffee, Damien, but we really try to build local capacity by saying who's going to be our vendor to develop the graphics. And we have them meet with our IT director, James Polstra, who is amazing. And we say, you're going to learn what we mean by 508 and 504, and we're going to work with you to develop the materials. We also have a team within the Rural Institute that can be working on that and vetting that for our materials. But again, they're spread thin just keeping up with our materials. So it is really trying to create allies and create capacity within the graphic design world that, you know, we contract to all the time, and putting it in their scope of work, that it will meet a certain standard and they will have it user tested by people with disabilities, many of whom are here, right? To see what you think. Is this going to work? Did you understand? And it is a part of the budget. It has to be a part of the budget. So I totally agree. We have to move from our recommendations to how do we make it really happen. So that's, and one note about AI, right? And you know this from your work. It's, you know, we have to be really careful that it's a starting place. It's going to represent some of what the community is telling us, but it's not going to be everything because, yeah, cool. That's.
There's one more question.
Yeah.
I was just gonna make a comment. Jesse, I'm at Montana State University. We at M as a faculty member, our Office of Disability Services as well as Center for Faculty Excellence will help us with universal design for all of our course content and materials. So.
Exactly. So things are available. I think that's our Office of Disability Equity. They're available. But again, if it isn't required, right, then we end up working one-on-one with students to fill all the gaps that exist for them. And we know this from the national STEM data. Flynn Murray is applying for some support to create more engineering opportunities with students with disabilities. We know from the national data from the National Science Foundation that students with disabilities in the STEM fields have so many more costs to access the information that's readily available to their peers in the program, because they're, you know, again, there's just so many gaps. But you're absolutely right. We have the resources. It's connecting them in a way that is more sticky, has more teeth to the faculty, and bringing those two together, I think is. So any more thoughts about how that is working at MSU that we can learn from? Or
Not really.
Yeah,
I just reach
right.
out to them
Yeah.
and they just do it.
and we need to evaluate that.
Yeah.
Oh, maybe no.
Okay. We'll talk later and get your input. That would be great. Because we do need to make a change. Good. Okay, great. I'm glad you stood up and felt ready to share. Yeah, we'll capture that. Thank you.
Thank you all so
Yeah.
much for having me today.
Awesome. Lindsay, I just want to say a special thank you. My question to you was, with the blood pressure, not only are people understanding it, are you going to follow up and see if people are more likely to talk about controlling their hypertension if they have it?
You know, that would mean I developed really strong partnerships with that program. But as you can imagine, that takes time to soften that ground.
Yeah.
So the most I got was like, oh, this is interesting. Like we are going to make some updates. But me trying to push, well, let's include people with disabilities in your application to the CDC, and we can do that. And so I'm sure that's probably also not surprising. Kentucky, sometimes those conversations take a long time. So we are not to that point yet, but I'm still making good friends at the Department of Public Health. So the pilot data is all that I have.
It's such a great place to start.
Yeah,
Thank you.
So, yeah.